We're going to look at Chapter 13 on professionalism. Professionalism is extremely important in healthcare. Although it is difficult to define and it encompasses a lot of different characteristics and behaviors, a healthcare professional who is professional, is dedicated and caring, provides high quality service, has a professional attitude, being committed to work, understanding how important the role he or she plays is to patient care, and being able to solve problems objectively. Critical thinking is a professional skill. It's very important that healthcare professionals develop and practice self-discipline. They should be in control of their behavior, and they need to have a positive attitude and be enthusiastic about work. This professional attitude provides the foundation for professional behaviors, this caring competence. A lot of students are attracted to healthcare because they want to help people, and that is caring, but you also need to be competent and professional in how you do so. Your actions will influence the patients that you take care of and their satisfaction with care. It's very important that you never complain about your work to your patients. Some examples of professional behaviors include being dependable, performing duties as assigned, being flexible, accepting differences in individuals, and treating everyone with courtesy and consideration. Professional behaviors include good communication skills, keeping your personal problems separate from work, which we just talked about, and being well organized and planning ahead. Professional behaviors also include behaving ethically according to values, conducting yourself calmly, and serving as a role model for good health. Setting professional goals and continually improving is also part of professional behaviors. It's important that you develop not only competence but an in-depth understanding of your work. This is extremely important in healthcare. You must be able to observe and listen carefully and, of course, ask questions if something doesn't seem right. You can certainly consult employee manuals or ask questions about policies and procedures at work and perform all your work neatly and accurately, dedicating time to acquire new knowledge and skills. So I think every one of us would agree that these behaviors certainly describe someone who is very professional. Part of professionalism is not only behavior, but also appearance. So appearance is an outward sign of professionalism, and it does influence the patient's opinions about the care that you're giving. In healthcare, appearance is generally conservative, so extremes can sometimes alarm patients, and dressing more conservatively shows respect for patients. You need to practice, of course, good personal hygiene, and that includes hair, hands, fingernails, clothing, and shoes. Follow the dress code where you work, and that can differ from work site to work site. Make sure that you use deodorant or antiperspirant and pay good attention to dental hygiene. It's very important in healthcare that you avoid perfumes and other strong smelling cosmetics, such as hairsprays. Some people are allergic to fragrances, and others may find them upsetting or nausea-inducing when they're ill. It's also important to avoid extreme styles in dress and grooming in most work sites, so you should check with your employee handbook for standards and consider safety of both yourself and others. So you would not want to wear dangling earrings or hair that could get caught in a piece of equipment for sure. Something that's a little more difficult to describe is professional distance. We talked about caring competence, so we're not saying that healthcare professionals should be aloof, but they need to maintain a healthy balance in the professional-patient relationship. Caring is good, but our patients are not our friends, and we shouldn't look to them for approval. That type of relationship can actually get in the way of good patient care, and our goal is high-quality patient care. It's important also when we talk about professionalism to understand that challenging situations will occur. They're part of the profession, and we can't react emotionally, but we need to react objectively with caring, but with a reasoned, well thought out response. It's important also to understand your behavior and reactions and to separate fact from emotion. We talked about problem solving in Chapter 1, so you might want to revisit that information. Part of any job, and that includes healthcare, is at times being critiqued or criticized. It is really important to understand that criticism can help you learn and grow. It is not always easy to take, but you need to react gracefully and not defensively. You need to learn from any criticism that's given to you. And if you're secure about yourself, you will be able to accept criticism and learn from it. Of course, you should evaluate the information and then use it for self-improvement if it does ring true. Remember, there's always room for self-improvement. Also, part of being a professional is joining your professional organization, because that can contribute to your growth and learning within the profession. These organizations not only promote the profession, but also ensure that professionals stay abreast of the latest knowledge. They usually require a certain number of continuing education units every 2 to 5 years, so you're required to stay up to date in your professional knowledge. These are also important for networking and advocating for not only patient care but your own profession. Finally, as part of being a professional, you may wish to become involved with leadership. Leadership is something that can help you grow. The characteristics of a healthcare leader include being very competent at what you do, very committed, and being willing to recognize and support the work of others. Characteristics also include dedications to high standards, belief that change is necessary, and serving as an example of or a role model for your profession. You need to be able to communicate well as well. And that concludes mini lecture 2C. Move on to the response to this mini lecture.